Oh my god. Blitz, Moxxie, Millie, and the crew run a startup business in the underworld. That's right, today we're reacting to the medical scenes and injuries from the dark comedy animated show Helluva Boss. I can honestly say I've never ever seen this show, so who knows what we are in store for. All right, let's dive right in.
I guess there is a god.
Oh! What the heck? You're just starting off with somebody just getting shot right through the chest. Sometimes bullets, they're just random. You can get shot once, it kills you. Get shot 20 times and you're fine. It just has to do with location.
With this company, I really wanted to prove that we're capable of doing the same things anyone else can. Like killing people.
What the heck? In the operating room, you can definitely have different types of circular buzzsaws that are super fine to be able to cut bone.
Doctor, he's not responding.
Wait a minute. In trauma, you need to go systematically through a process. Airway, breathing, circulation. When it comes to non-trauma related cardiac arrest, it's maybe cardiac, then airway, breathing.
Oh, what a stat!
The blood hanging in the background is showing A positive. Unless the person has A positive blood, you can cause an allergic reaction or a rejection reaction.
It didn't do anything!
Actually, be surprised, the face just swells up pretty bad. Sometimes we'll actually have to do a CT scan of the face to make sure that there's not a collection of pus in there.
Damn it! I'm not losing another one.
Hopefully it doesn't lose that many people. The percentage of survival in cardiac arrest patients is pretty low. The defibrillator pads in his hands, we don't use those anymore here in the United States. We use disposable ones.
Clear!
Oh my god! They're randomly putting all these paddles on this patient. Typically, it's the flank on the left and right upper. And the reason why you do that is you're trying to get a conductive force between those two, and your heart's in the middle.
Holy it actually worked.
Sometimes you do something in the emergency department and you're shocked it worked. Sometimes doing MacGyver things or you're following the algorithms. That's why we always try and we always work hard in the emergency department no matter if we feel that it's futile in certain situations.
He appears to be in stable condition, but he'll need surgery. Now, what insurance provider do you freaks have? His insurance!
Oh my gosh, they're trying to kill him. That is funny. Here in the United States, by law, they have to do at least a medical screening exam. Patients can refuse care if they want, but we have to examine you if you come to the emergency department. Doesn't matter if you have money or not.
Yeah, that's not exactly how it works, ladies. Sorry, your fire doesn't really hurt us.
Yeah, that's kind of what I thought. They're already in hell. They probably like the hotness, and they're dead too, I think. We see burn injuries all the time. The other thing you have to think about is inhalation injuries. It's actually taking the oxygen away from you. So you actually are going to be suffocating probably more than you're going to be burned.
I'll just shoot you in your smart mouth!
That would be more effective.
Blitz!
Whoa! Could you potentially survive that? There's always a possibility, depending on where in the brain you get hit and then how much bleeding and other basic organs that were involved in the shooting. What? These guys are just offing people? Holy cow. You gotta be really careful in situations where you're drinking alcohol, your inhibitions are down, your judgment is down. Somebody says, oh, just follow me. You don't tell somebody where you're going, you can get killed. You can get jumped. You can be taken.
That's 9 kills in the bag.
Could some of these injuries actually kill them? More often than not, you're gonna cause maybe a skull fracture, maybe some bleeding. All these injuries would probably end up in the emergency department and you can get evaluated and probably survive. What the heck? Most of the time when we see like blood squirting, it's an arterial bleed and it's one shot. And then when it happens, you literally can just stick your finger in it to stop the bleeding. My favorite part is they're just hanging on to the uvula of the fish monster, which is like the punching bag that we have in the back of our throats. Sometimes people actually have their uvula removed if they have bad sleep apnea. Wow. When we see dilation, typically you can see that in somebody on speed. So opiates will actually cause your eyes to constrict. We'll actually give Narcan, which is a reversal agent. We see a lot of these like neck type injuries. Most of the major vessels are on the side near your muscles. When you slice those open, you can die pretty fast, but if you can stick your finger on it, get the bleeding to stop, then you actually should be okay. But that needs to be sutured back together. Whoa!
Stop looking.
I can't stop. I've never wanted to die more than I do now.
If you get stung by a bee enough, you can actually have an overwhelming reaction that could be almost similar to an allergic reaction. What we call when people actually get fluid and swelling in the tissue, it's called third spacing. It's a new formed space that wasn't there before to where all the fluid ends up going. We actually see a bunch of chainsaw injuries. Basically, people who aren't paying attention, the chainsaw can bounce and you can hit yourself. Most of the time it doesn't go all the way through, but it actually can rip through the tissue. If you're impaled, say it goes right through your artery. The minute you take it out, now you have a hole in it and it's gonna pour out. So if you leave it in until you get to the hospital, then you take it out and you go to the operating room and we can fix it right up.
A wonder of art and music. Something always there to comfort, entertain, and live for.
We see people near their end of their lives, but for some reason, their body is holding on to something. A lot of times what we end up seeing is somebody who's been sick for a week and shows up to the hospital, boom, they just die right then and there. They get to a place where they feel like they're safe and the body totally relaxes and they plummet. Oh no! Depending on how high you drop something, you can kill somebody pretty easily. Same thing as somebody jumps from the same heights. But it all depends. It's a wide variety of injuries that could occur. Whoa. A lot of times people will come in where somebody actually complains that they were strangled. The biggest things we worry about in the emergency department, one, airway, and then two is actually vascular. There's always an issue that you can potentially get a dissection.
Pathetic.
There are different ways, self-defense, if somebody comes from behind you. A quick one is trying to throw the person off balance by changing your center of gravity and then using different types of leverages, obviously trying to do it sooner than later when you have the most amount of energy. Oh my gosh. If somebody has a stab wound, bring to the emergency department. It could be nothing or it could be something super crazy deep and you need a surgeon to take a look at it. Whoa, I was not expecting that. They just created mayhem galore. There were a lot of good teaching points related to what we deal with on a daily basis in the emergency department. If you guys like this, let me know in the comments. Let me know if you want me to do more shows like this. Check out this playlist right here. Binge watch all my reactions. Make sure you subscribe, turn your bell notifications on. Thank you so much for watching and stay healthy, my friends.